Hello, my name is Jaime Colley. I live in Sapphire, Central Queensland, Australia. I have huntingtons disease. I have been on depression tablets since I was like 16, probably more like 15, 14, something like that. I have tried over 30 and they have done nothing to help me. Nothing at all. They don't work. I don't know why, but they don't. I've tried every single different one. The huntingtons doctors have tried. My normal doctor, Dr. Porter's tried. Now I gave up on them. So I am 39 years old and I have depression, anxiety, panic attacks, OCD, social phobia. Now, the problem is that because of the stupid healthcare system we have in Australia, I'm laying in bed trying to kill myself, trying to overdose myself so I can end my life. But I can't do it. I can't do that to my kids. So I'm trying to lay here thinking of what to do, how to help, how to get help. And there's no way to get help. Talking to someone about my issue like it's not going to help. I don't know what to do anymore, but I know the government has no system in healthcare. It takes months out here to see someone, and not to mention the money. So the government needs better mental health care plans for us. My whole family suffers. I'm a sibling of 5, 1 of 5. And my nieces have trouble. She's got a lot of things going on. There's no trouble for her. My sister's been on suicide 1,000 times. Nothing. All you ever do is do a 48-hour hole into a base. It's not enough. We need a place that we can go and figure out how to get fixed. We need help. Mental help. We should be able, if we cannot afford a doctor, we shouldn't have to pay for one. If we cannot afford a psychiatrist, we shouldn't have to pay for one. Us poverty people need help. With the rise of cost of everything, I can't afford to go to the doctor. I can't afford to go for a psychiatrist. The one person that I've actually found in 15 years is in Toowoomba, which I can't even do by phone because I can't afford to pay him. Being in the bush is even worse because it takes months to see or get plans or costs lots of money. And I don't have it. I already got all my children needing things. I can't even get my son a test for ADHD because it's been fucking a year since we've been on the waiting list out here for the pediatrician at Emerald. Because that's what it is. Bush health sucks. Even worse than all the rest of Australia. But what it comes down to, health is very important. Mental health is even more important. Should be at the number 1. We shouldn't have to wait people have to pay because we can't afford it, and people who can't afford it, they will not use it or do it. 10 appointments for the payment plan thing that you put in place at a doctor's is not enough. When you're going through something and need a psychiatrist, you should be able to do it once a week without having to pay. Psychiatry and doctors should be available. Without this, we are all screwed. Even the little people to the big people. Without help, I don't think it looks good. I need mental help and I'm not going to get any. So, shall I kill myself now? Or should I try and get on with it? But there's no choice. Because there is no help. I can't ring the hospital and say, look, I'm really feeling really bad and I want to kill myself. Because they're not going to do jack shit. Hold me for a couple of days. Because depression tablets don't work. There's no other way. I want to try the CBD oil, cannabis oil, but I can't because it costs too much money. I want to try cannabis like my American friends that have huntingtons, but it costs too much money. This life is too much money, and when you've got a disease, it's hard enough getting up every morning, but then to have all these other problems and not be able to have money for them, it's just too much. We need help. We need help now. So I'm urging the government to help us little people. People like me that can't go on depression tablets because they do nothing. I'm over it. I need something else, but I can't afford the oils. I can't afford $400. That's just crazy. Most weeks we can't afford to pay our bills or food, let alone things. But without that oil, I'm lost. Because depression tablets haven't worked, it won't work. I am done. I need something else. And there is nothing else because you haven't made it available for us people. You shouldn't be having to suffer like this because you just can't get your heads straight on. So I'm pleading to the government and medical people to make our lives easier. Goodbye.